Welcome to Go Vote Omaha, presented by the League of Women Voters of Greater Omaha. I'm Geri Simon, a League member and your host. Each program we talk about important public policy issues. We hope you'll discuss those same issues, and then at election time you'll be ready and willing to go vote. This program we're going to talk about the American Health Care Act, Medicaid, budgets, money, and we're going to do that with our guest who's the Executive Director of Voices for Children in Nebraska, Aubrey Mancuso. Welcome, Aubrey.
Oh, well, thanks for having me.
Thanks for being here. Let's start out by telling our viewers about Voices for Children in Nebraska.
So we are a 30-year-old nonprofit, and our goal is really to make Nebraska the best place to be a kid. And there are a lot of agencies that focus on helping children one child at a time when their needs aren't met. But our focus is really on improving the systems that are surrounding our kids and ensuring that they're giving all our kids the best opportunity to succeed. So we take data and research and we use that to empower communities and empower state leaders to make better decisions on behalf of the next generation.
Okay. Well, before we get to talking about the American Health Care Act that was just passed by the House of Representatives on the federal level, let's talk a little bit about Nebraska, what was done with the 2018-19 biennial budget just passed. I think a lot of us were surprised that the governor vetoed about a little over 33 million, almost 34 million in budget. He cut the budget, vetoed those provisions for Medicaid and child welfare, behavioral health, and the veto override failed in the unicameral. So what has those cuts, what do those mean to Nebraskans and families and children?
Well, I will say that what the Department of Health and Human Services is saying is that they intend to absorb those cuts elsewhere and keep provider rates flat. So we're definitely watching to ensure that that's going to be the case. But I do think that we need to be very cautious about cutting those provider rates because they're important to ensuring access to health care, particularly for our Medicaid population. If we're not paying our providers enough, nobody is going to want to serve that population. And a lot of our areas in Nebraska already have a shortage of qualified providers, taking Medicaid or otherwise. 92 of our 93 counties are mental health provider shortage areas, and 65 of our 93 counties are primary care provider shortage areas. So any sort of destabilization in rates can have a negative impact in creating additional challenges there.
Okay, so something to watch very closely.
Absolutely.
Okay. And Nebraska was one of the states that did not expand Medicaid under the Affordable Care Act. What did that mean for our families and for Medicaid recipients?
Well, in short, it meant that there was a population that was unable to access affordable health care coverage after the passage of the Affordable Care Act. As it was initially envisioned, that wasn't supposed to be optional. So the expansion of Medicaid was really supposed to provide health care access and get everyone in the system for a population that's not really able to afford insurance on the private market. So, now as we're considering additional changes to Medicaid at the federal level, I think there are a lot of questions about what Nebraska's not expanding Medicaid will mean. And because we're currently taking less money from the federal government for Medicaid, whether or not that'll impact what we get going forward if they change how they're paying for Medicaid at the state level.
Okay. Well, talk a little bit more about Medicaid in Nebraska and what it does do for our residents, our citizens, families, children.
I can't really overstate the importance of the Medicaid program, particularly for kids. I think there are often misconceptions about who our current Medicaid population is. In Nebraska, 69% of Medicaid participants are kids. So any changes that we're talking about to Medicaid have a significant impact on children. The remainder of the population is primarily seniors, low-income seniors, many of whom are in nursing home, and then individuals with disabilities. And Medicaid for those populations really helps fill a critical gap in providing health care to a population that is not necessarily as attractive to the private market. And for kids, healthcare access in those early developmental years is really just so important and impacts their long-term health outcomes. It impacts their ability to attend, participate, and succeed in school. And so it's really an investment in the future success of our young people as well.
Okay. And also, when you mentioned low-income elderly and Medicaid, I think a lot of people need to realize that a lot of elderly who are in nursing homes, they become low income because they exhaust all their resources and then have to go on to Medicaid to be able to pay for that care. Right.
Nursing home care is very, very expensive. And very few families are really equipped to afford that in the long term. So Medicaid provides a vital safety net when seniors have high health care needs and need to be in a place where they can be safe and taken care of and can no longer have the financial resources to pay for that.
Okay, and we have an aging population, particularly in Nebraska, so that's going to be even more important.
Absolutely.
Okay. So the American Health Care Act, that it was called in the House of Representatives, supposedly to replace the Affordable Care Act, replace it, passed the House, and it really makes a lot of draconian cuts of about $1 trillion in health care costs. It cut Medicaid by about $839 billion, and it eliminated Medicaid expansion. So how would those changes and cuts affect Nebraskans? If it goes into, I mean, it's only passed the House. It hasn't even gone to the Senate.
Yeah. Well, I think, we in particular at Voices for Children are very concerned about the changes and the cost reductions to Medicaid. Just because we don't provide the money doesn't make the healthcare needs go away. And it would really be a huge step backwards in access to health care for kids. Medicaid and Medicaid's sort of companion program for children, the Children's Health Insurance Program, also known as CHIP, has made great strides in providing health insurance for kids in this country. And right now in Nebraska, 95% of our kids have health insurance. And that's great news, and that's been a long sort of uphill climb to get to that number. Medicaid provides healthcare access for about a third of our kids as well. And so if there's a fundamental change at the federal level in how much money states are getting for that program, there's going to be a huge impact on kids. And then, of course, there's about 20,000 seniors and 30,000 individuals with disabilities that would also be impacted by those changes as well.
And what about rural versus urban residents of the state? Is there a difference in terms of how we're seeing Medicaid impact in rural communities versus urban communities?
Well, Medicaid in rural communities is really critical. In some more urban areas of the state or in larger cities, you often have other safety net providers. Our federally qualified health centers, so Charles Drew and One World here in Omaha are examples of those, can fill some of those gaps for people without health insurance, but they're not available in every community in our state. So when you're reducing access to Medicaid, you may be forcing people to rely on safety net providers who are hundreds of miles from where they live if they want any affordable access to care.
Okay. What about the effect on our hospitals? I mean, I know that some hospitals in other states, particularly with Medicaid expansion, that's saved hospitals in rural areas. What about here in Nebraska? Are we still facing a crisis with our hospitals?
Well, I think our rural hospitals were very concerned about our decision not to expand Medicaid because they have to provide urgent care for everyone who walks through their door. And providing that emergency care is not the most effective, cost-effective way to provide care. Really, you want people to have health insurance because they can see a primary care provider and get preventative health care visits and address issues before they become more costly and more complicated to treat. And so when you're not doing that, you create additional pressure on our hospitals. I know we've been talking a lot with Children's Hospital here in Omaha, and they have a lot of concerns about the changes to Medicaid in this bill. They're serving children with very complex, often healthcare needs, and a lot of those families are relying on Medicaid to get those treated, and they're not sure what their future would look like in being able to serve those children with fundamental changes to Medicaid.
Okay. One of the things that a lot of people have been critical of is that the House went ahead and passed this bill without waiting for the Congressional Budget Office to come out and redo the figures in terms of what it would mean. And those figures just yesterday, before we've done our show, came out and shows that probably 23 million more people would become uninsured with this American Health Care Act. So talk about that a little bit.
Well, I think it is concerning that they didn't wait for that information before voting on the bill, because what it really tells us is how is this going to impact the average American and constituents and people who are relying on these healthcare systems. And unfortunately, I think it suggests that the vote was much more about politics than it was about really thinking about the policy. And healthcare is a tough, complex issue, and it impacts people's lives in a very real way. And so I think healthcare in particular should never be about politics and should always be about policy. So we should always thoughtfully consider how that impacts our populations.
It's an emotional issue too, isn't it?
Absolutely, absolutely.
Okay. One of the things that, under the guise of flexibility for states, is that the Health Care Act would let states add work requirements to Medicaid recipients. What do you think of that, and do you think that that's something that Nebraska legislators, if this would pass, would be looking into?
So the American Health Care Act does allow that, but actually states could potentially be allowed to do that even without the passage of this bill, by applying for something called a Medicaid waiver. And Medicaid waivers can be used to innovate in how we're providing care and serve populations in a better way. Unfortunately, they can also be used in ways that reduce access to care. And we've already seen under the new administration some states apply for waivers to add work requirements to their Medicaid program. I know Maine and I think Wisconsin are already considering proposals like that. In Nebraska, I don't think that would make a lot of sense for us without Medicaid expansion. Because the majority of our population, right, is children, the disabled, and the elderly in nursing homes. So there are a lot of the populations that would be exempt from these work requirements anyway. I do think that there are other troubling provisions in those waivers, such as setting lifetime limits on care, that could be very, very troubling if the state decided to pursue that.
And so far, Nebraska has not applied for any kind of waiver for the program.
Right,
through its history, okay.
Yeah.
Okay. Another thing that people are talking about with the American Health Care Act is moving Medicaid to a block grant system or program. Explain what that means. What are block grants? How would that change Medicaid? And what would that mean for us in Nebraska if that were to happen?
Right. So right now, the way the Medicaid financing works is that everyone that's eligible can enroll, and then the state and the federal government share that cost. This would change the structure to either give states the option of either having per enrollee caps on how much they can spend on every individual enrolled in the program, or having a block grant structure where they get a fixed amount of money to provide health care and have to figure out how to provide services within the amount of money that they're given. And this is a huge change. This Medicaid program existed long before the Affordable Care Act. It was working for these populations long before the Affordable Care Act. And this would be a huge change in how that program is funded.
Okay. And I think I've read one example of the block grant provisions or program and how it doesn't work would be Puerto Rico is an example that's had experience at.
Right.
It's not a state yet, but it's had experience with it. So would you talk about that a little bit?
So as a U.S. territory, Puerto Rico is getting a block grant from the federal government to provide Medicaid, except that like Nebraska, the state largely has an aging population. They have a high population of people with disabilities, and they have a lot of children. And so that has put a lot of strain on the Medicaid system and actually driven them into a pretty significant financial crisis that they had to come to Congress and ask them to bail them out. And it's really impacted the entire state financial system as a whole, with trying to address all of their healthcare needs without having adequate funding to do so.
Okay, so that's certainly something that other states should be wary of, this particular change.
Absolutely.
Okay. Could you talk a little bit about, I think a lot of people don't realize that there is a special education impact with Medicaid, and that school districts actually get Medicaid funds for providing some services. So talk about that a little bit. And do we use that in Nebraska? Do we use funds for special ed?
Yeah, so in a lot of ways our special education system has been underfunded for a long time, and so one of the ways that states have addressed the gap between the needs and the money that they get is through being able to use Medicaid services in schools, particularly with children with special needs. Schools are required to provide services to that population under the Individuals with Disabilities and Educate, the IDEA Act. And they're sometimes able to access Medicaid services to fill gaps. I think Nebraska schools are getting about $26 million annually in Medicaid dollars for those special education services. If that goes away, again, the requirements to serve these populations don't change. So if we're not able to really make up that money elsewhere, I think that's something property taxpayers should probably be concerned about as well. Because that puts additional pressure on our property tax system when we don't have adequate
the schools.
funding.
And special education is not inexpensive. I mean,
Right,
so
absolutely.
that $26 million would be a huge hole.
Absolutely.
To have to cover. Okay. One of the things I think we should talk about definitely that people have liked about the Affordable Care Act that is really impacted by this new legislation, or would be, is pre-existing conditions. There's been a lot of talk that people are protected. There's a lot of evidence that they're really not in this new bill. So talk about that a little bit.
So what the bill does is it allows states to opt out of the current requirements that require making healthcare coverage affordable for people with pre-existing conditions. And instead, what states would be allowed to do is to utilize a high-risk pool for that population. High-risk pools are a very old idea in healthcare. They were around long before the Affordable Care Act. Nebraska had one, as did 34 other states. They were continually underfunded. A lot of the people who needed that care couldn't afford the really expensive insurance provided through those high-risk pools. So there's really not a way that you get to the same level of healthcare access that people with pre-existing conditions currently have in a high-risk pool. Again, Nebraska would have to make that decision to opt out, so we don't know what they would do in those circumstances, but it would certainly change the landscape for people with pre-existing conditions.
So it could go back to the thing that we were dealing with before, that maybe you were technically able to purchase insurance, but could you afford to buy it?
Right, that's exactly it. It's an idea we've tried before and it didn't work, and it's part of why the Affordable Care Act was created. So it would definitely be going back to a system that wasn't working very well for people before.
Okay, and then also within talking about the pre-existing conditions, I mean, if you look at the demographics in terms of ages, the cost of care is very different under this proposed plan. Is that right? Will costs go up?
So according to the CBO score, there are some people who will see costs go up, and it's primarily the elderly and people with lower incomes. So you're going to see people who can sort of least afford care, given their circumstances, see higher costs for health care.
Okay, particularly pre-retirement people who might be in that age range between 60 and 65.
Exactly, before they're eligible for Medicare to fill some of those health insurance gaps.
So some people may have to put off retirement.
Absolutely.
Even if physically they really need to retire.
Right.
We're not doing anybody a favor by changing it.
Right, and I think that's a population that we don't want to increase, premiums for. They also, as they're nearing the end of their working life, don't have a lot of time to save and plan for these type of changes as well.
Right. Okay, so we have the American Health Care Act, but now we have to look at the proposed federal budget the president just came out with, and that's on top of what the American Health Care Act does. It has even more cuts. It's going to cut Medicaid billions over the next 10 years, 5.8 million to CHIP that you talked about, and then cuts to SSDI, the Social Security Disability Income, and also cuts SNAP, or properly known as the food stamp program. So talk about the budget impact on top of if the American Health Care Act would be enacted by the Senate, and if this budget would go into effect, what would these cuts mean?
You know, I think the troubling thing about all of these proposals taken together is we've seen an increased desire to sort of cut programs and service that vulnerable people like children, like people with disabilities are relying on to meet critical needs. And at the same time, we're talking about tax cuts that would primarily benefit wealthier individuals. I think that's troubling not only from a values perspective, but when we're looking in particular at kids, not investing in our kids now has social and financial consequences later. CHIP is a very effective program. It provides health care access for individuals who don't qualify for Medicaid because they make slightly too much money but can't afford insurance on the private market. It has many of the same benefits as Medicaid for kids. SNAP is a critical program. Half of our SNAP participants in Nebraska are kids. There's also a lot of low-income seniors who are receiving benefits from SNAP, and that access to healthy food is important for both of those populations, and it's also an economic driver because that's money that's coming into the state and it's going to farmers markets and going to local grocery stores. And I think it's very short-sighted to think about cutting these programs that are working and have been working for decades, and not giving any meaningful options for replacements.
I think talk a little bit about, there's a misconception that a lot of the people who are receiving these particular benefits, like food stamps, are not working. They're not pulling their weight. But many of them are the working poor. They are working jobs, maybe 2 or 3 jobs already, and they still need this assistance. So it's not like these are losers or deadbeats who are getting these benefits.
Yeah. And SNAP does have work requirements as it stands. So in general, those who are on SNAP and can work are working. So they really are work support programs. And for some people, they make work worth it, right? Because they fill that gap between their income and what they really need to make their basic needs every month.
Right. Okay. The one thing that is troubling too when you talk about it is would the American Health Care Act, if passed, and then the proposed federal budget on top of that, would that really lead us to rationing of health care?
Well, I think, in particular, the proposals around Medicaid, our healthcare needs don't go away just because we don't want to pay for them. And so I think that there would have to be some very critical decisions made at the state level about how to provide health care with less. Is that we serve fewer populations by not providing coverage to as many kids or as many seniors or as many people with disabilities? Do we provide less care to those who are already receiving that care? The only other real option for the state would be to increase taxes and make up those funds to get to those real costs. And unfortunately, I think that's not likely to be how the state would address that shortfall of funding.
Okay. So what can we do to ensure that really this bad legislation and a budget that's really cruel and short-sighted, I think, what can we do to stop it from happening? What should we do?
Well, the American Health Care Act has already passed the House, so it's really now over in the Senate. So I hope everyone will be talking to Senators Sass and Fisher about this bill and their concerns about it. I think writing letters to the editor is also a really good way to share thoughts on these issues. And then, of course, when our senators are in the state, attending town halls and respectfully sharing concerns about these bills, I think is really important.
Okay, good, and the league would agree with that. We
Absolutely.
urge our people to do the same thing. We have a couple minutes left, and one thing I want to do is, what more do we need to do in Nebraska with Medicaid, and what do you foresee for the next session of the unicameral next year? They've already adjourned for this year, so
Right.
what about in next year's session? What should we look for? What should we want our senators to do regarding Medicaid?
Well, I think if I had one word to describe this year's legislative session, I would describe it as unpredictable. So I'm really hesitant to predict anything about what comes next. But there was definitely a lot of pressure around the issue of income and property tax cuts. And that's an issue that's not going away. And I mention that in the context of healthcare because we're not going to have money to pay for some of these services like healthcare if we completely decimate our revenue sources. So any cuts need to be careful and thoughtful and paid for. And the Medicaid expansion bill that Senator Moorfeld introduced, it's still out there. It'll stay alive going into the next session. Unfortunately, I'm not sure that the will of senators to support that legislation will change. But if there are major federal changes, there'll be a whole new set of decisions
Right.
for our state to be making. So I
Right.
think watching for those will be important too.
But it can't hurt for constituents to let their senators
Absolutely.
know you should
Always.
pass it.
Yeah, and especially our state senators.
Right.
Yeah.
Okay, well, quickly, if someone wanted to contact or look for Voices
Yeah.
for Children in Nebraska, do you have a website that you can tell us they can find you?
Yeah, please visit us at voicesforchildren.com. Easy to remember.
Okay, phone number at all?
Yeah, it's on our website or
Okay.
402-597-3100.
Okay. Well, thank you so much for talking about healthcare, Medicaid, and budget woes, basically. So,
Well, thanks for having
thanks,
me.
Aubrey. For the League of Women Voters, I'm Geri Simon, reminding you to inform yourself about the issues, and at election time, go vote, Omaha.